anger, fear, sadness, anxiety. It's probably safe to say that many of us have been feeling at least one, if not all, of these emotions since the COVID-19 pandemic began. Sure, these are feelings that are normal in a situation like the one we find ourselves in, but it's important to self-monitor to avoid more serious problems. Elena Van Gelder is a licensed graduate professional counselor with Chesapeake Healthcare, and she joins us this afternoon to kind of talk about all of this that we're feeling. Thank you for being here this afternoon.
Thank you.
All of us handle, obviously, anxiety and stress in different ways, but at what point is it a health concern?
Sure. So when anxiety and stress turn from our daily survival skill of anxiety and stress, as it is, right? Because if we didn't have that, we wouldn't know what to do. But when it reaches a really unhealthy level, we're seeing a lot of hypervigilance, meaning just an increase in like a hypersensitivity almost, in cleanliness, or not that cleanliness isn't good, but in an obsessive way.
Right.
We're seeing people watch the news obsessively. We're seeing a lot of irritability, loss in sleep, anger, as you mentioned. There are a lot of symptoms of anxiety and stress, and then they can begin to manifest in physical symptoms as well. So it's always a good idea to kind of keep a pulse check on where are you on the spectrum of anxiety? Where are you on the spectrum of being able to manage your stress level effectively?
Sure, sure. Now, and then throw into this mix the fact that we're supposed to be self-isolating, or we have the social distancing. For some people, that can be awful. I mean, lonely, right?
Yes, very. We're seeing, in our practice now, we're seeing a lot of increase in feelings of loneliness, feelings of isolation, as you mentioned. And so an important thing to remember with that is, again, be very cognizant, be very aware of, am I feeling isolated, therefore I'm feeling lonely, therefore I'm feeling alone, therefore, and it kind of trickles down. And so being aware of that and being able to say, I need to connect with people, whether it be virtually. It also is an important time to self-care, and self-care is so crucial on a daily basis.
Sure.
But especially during this time. So developing new hobbies and interests that you're able to do in your home or in a safe space, and just kind of really indulging yourself in loving kindness.
Yeah, absolutely. And you mentioned technology. We really can take advantage of video chats and things like that.
So at Chesapeake Healthcare, we are offering a telehealth option. It is not mandatory at this point. I know things are changing by the minute, but we are offering a telehealth option to our clients and our patients in the mental health side of the house.
Sure.
And so this enables them to still receive services from a therapist, from their psychiatrist, and continue on that way.
Well, that's good to know. Absolutely. Okay, let's talk a little bit about our first responders and our healthcare professionals. They are really taking on a lot right now. How can they avoid being just completely overwhelmed?
Yeah, overwhelm is something that can happen in the general population, but like you're saying, especially in first responders and our healthcare professionals. So it's important to maintain consistency in scheduling. It's important to maintain the self-care routine, whether it be exercise or hobbies or what have you. And it's really important, and I know I'm saying it again, but to keep a pulse check on what am I feeling and what do I need? Do I need to seek mental health services? Do I need to seek virtual experiences with friends and family? That kind of thing. So I can't even speak to first responders and some of these healthcare professionals that are on the front lines and what they could even be feeling right now.
Yeah.
But it is so important to just kind of consistency in scheduling.
And there's no shame in reaching out for help.
Absolutely. A lot of times people think, well, mental health means I'm crazy. Well, no, if you have a brain, you have mental health. If you have a body, you have physical health. And so we all have mental health. It just depends on where you are on the spectrum of needing to talk to someone and vent and get it out and get some productive feedback.
Oh, absolutely. Elena Van Gelder, thank you so much,
Thank
so
you.
much information. But up next, you're going to help us deal with our children and the anxiety that they may be experiencing right now. Elena Van Gelder from Chesapeake Healthcare is back with us, and we want to switch our focus to kids. I mean, they really are getting the brunt of this with all of their schedules and everything being disrupted. So are you seeing this?
Yes, we are. We really are. It's a struggle. It for sure is. I think one of the most important things to remember with our children is that they are like sponges. So they are really soaking this up. I don't want to say more than adults. I don't want to compare, but it's really affecting our kids.
Yeah, because they pretty much kind of bounce off of us what we're, if we're panicking, they're going to panic,
Yes.
right?
Yes.
Okay, so do kids, do they manifest anxiety in different ways like adults?
They do. They do. We might see increased irritability, again, the disruption in sleep pattern. We might see anger outbursts, the hypervigilance or hypersensitivity to their surroundings. So it's a lot of the similar symptoms, similar but different, right, in a mini version.
Yeah, yeah.
Not mini on scale, but mini in person.
And you and I, we know when to, like, you know, take a time out and to maybe seek some help. How do we know our kids need that help?
Yeah. So any change in behavior that you're seeing that's adverse or not helpful, you know, we really want to pay attention to that, keep tuned into that, and take time to really be mindful and intentional in our interactions with our kids. And if you are noticing behavior shifts, if you are noticing sleep disruption and so forth, as I mentioned before, it's a time. It's a time to get them some assistance.
When my kids were little, one of my kids, I noticed that he would complain about a tummy ache in stressful times. And I didn't learn until he grew up that that could possibly be a sign of anxiety.
Anxiety absolutely manifests in the digestive tract and in the stomach region. It manifests in muscle tension. It can manifest in a whole host of physical symptomology. And so kids are no different in that respect. They may get a tummy ache. They may complain about not feeling good, you know, and certainly it's an opportunity to get their physical health checked, but it's also an opportunity to get some mental health help as well.
So what can we do to help them?
Yeah, limit the time that we're watching the news, not just for ourselves, but also for our kiddos, because they are absorbing, and they're absorbing, like you said, our reaction to the news. You know, keep that to a necessary minimum, excuse me, you know, to get important information and things like that. But also, it's important to keep consistency in scheduling as much as possible, same as adults, and practice some mindfulness, some breathing, some noticing of feelings.
But is there a point where we just need to maybe see a professional or have them talk with somebody?
Yeah, it's crucial at any time. I'm a little biased, but I'm an advocate for mental health therapy at any time. And it doesn't have to be a forever thing. It could be a right now thing. But if you're not sure, call and get an evaluation. You know, get an intake. Just get some more information with regards to anxiety, stress, mental health, anger, things like that.
Yeah, yeah. Elena Van Gelder, Chesapeake Healthcare, thank you so much.
Thank you.
For coming in and talking about this important subject.